Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about urticaria. In particular, I'll cover what it is, how you treat it, and how you can better live with urticaria. So to start with, what is it? Urticaria, or chronic hives, are batches of raised red or white, itchy welts of various sizes that appear and disappear, while most cases of hives go away within a few weeks or less. For some people, they are a long-term problem. Chronic hives are defined as hives that last more than 6 weeks, or hives that go away but recur frequently. So in most cases of chronic hives, a cause is never clearly identified. So in some cases, chronic hives may be related to an underlying autoimmune disorder, such as thyroid disease or lupus. While the underlying cause of chronic hives is usually not identified, treatment can help with symptoms. For many people, antihistamine medicines provide the best relief. So symptoms of hives generally appear as small round wheals, rings of large patches, and may change shape. The itchy and may be surrounded by a red flare, and they occur in batches and often appear on the face or the extremities. And individual hives can last from 30 minutes to 36 hours. As some hives disappear, new hives may develop. About 40% of people with chronic hives also have angioedema. So signs and symptoms of angioedema include large welts or swelling of the skin that may occur around the eyes and lips, hands, feet and genitalia, and inside the throat. Swelling in the throat can obstruct breathing and requires emergency treatment. Angioedema may itch less than hives do, but can cause pain or burning. Symptoms may not occur all the time. They may come and go with no apparent trigger. For some people, certain conditions such as heat, exertion or stress can make symptoms worse. Chronic hives are an inflammation of the skin triggered when certain cells, mast cells, release histamine and other chemicals into your bloodstream, causing small blood vessels to leak. The exact cause of chronic hives isn't well understood, and triggers can be difficult to pinpoint. Chronic hives are thought to be caused by an immune system or autoimmune disorder and may be linked to another health problem such as thyroid disease or lupus. And rarely a reaction to medication, food or food additives, insects, parasites or infection is identified as an underlying cause of chronic hives. But in most cases, the cause of chronic hives is never fully identified, even after testing and monitoring symptoms. Heat, cold, pressure, sunlight or other environmental stimuli may worsen chronic hives. Certain pain medications such as aspirin, ibuprofen and naproxen can also worsen hives. So complications of hives and angioedema include the itching. Hives and angioedema can cause itching and discomfort and difficulty breathing. More serious cases, when swelling occurs inside your mouth or throat, complications can include difficulty breathing, leading to a loss of consciousness. If you have a swollen throat, seek medical care immediately. And anaphylactic shock or anaphylaxis. This is a serious allergic reaction involving your heart or lungs that can also be associated with hives and angioedema. Your bronchial tubes narrow, it's difficult to breathe, and your blood pressure drops, causing dizziness and perhaps loss of consciousness or even death. Anaphylactic shock occurs rapidly and requires immediate medical care. So next is, how do you treat hives? Finding an effective treatment for chronic hives can be challenging. In cases in which a trigger is identified, such as a reaction to a certain food, medication or physical stimuli, the treatment includes obviously avoiding the trigger. If your chronic hives are caused by an underlying health condition, they may improve when the underlying condition is treated, and symptoms can be treated effectively in most people with over-the-counter or prescription medicines. Work with your doctor to find a medication or combination of medicines that works best for you. If the first medication you try doesn't relieve your symptoms, talk to your doctor about trying something else. So oral antihistamines. These medicines block the symptom-producing release of histamine, controlling symptoms for the majority of people with chronic hives, but they do not treat the underlying cause of the rash. Antihistamines are divided into two categories: older first-generation drugs and newer second-generation medicines. Each category includes non-prescription and prescription drugs. A combination of antihistamines may work best. So examples include Claritin and Zyrtec, so first-generation older antihistamine. If a non-sedating antihistamine doesn't work, your doctor may recommend taking a first-generation antihistamine. These antihistamines can make you drowsy and impair your ability to drive or perform other tasks that require physical coordination. This class of antihistamine includes Piriton or chlorpheniramine. And finally, how do you live with it? The following precautions may help prevent hives and angioedema. Avoid known triggers. These may include certain foods or food additives, alcohol, medicines, and tight clothing or emotional stress. Keep a diary. Track all your activities, when and where hives occur, and what you eat. This may help you and your doctor identify the trigger. Avoid medicines that may trigger hives. These include the aspirin, ibuprofen, naproxen, maybe codeine or any other medicine that you've noticed can trigger your hives. Finally, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you in managing hives more effectively. To start with, we have numerous products to get you started on a gentle exercise program, such as exercise balls, floor mats and weights. We also have various supplements and products which you can purchase from us without a prescription, such as antihistamines like Zyrtec, Claritin, the drowsy antihistamine Piriton, Antisin cream, Urax cream. We also stock light boxes to promote relaxation, blood pressure monitors, blood sugar monitors to monitor your health. And so that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us and we help you increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing hives with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.